So it started actually in Wuhan, China, and it was traced back to a seafood and meat market there.
All right. Let's get a little bit more local.
Sure.
How many cases of COVID-19 are there in Florida right now?
In Florida right now, there are 14 cases.
Do we know how many people are being monitored as well? That
Let's
maybe they have a
see. I
case, maybe
just
they
pulled
don't have
that
a
up,
case.
and let me. I know it's because some of the information they update quite often, which is a good important thing to let you guys know. If you go to floridahealth.gov and you click on the COVID-19 information right there in the center, it's going to take you right to this information. But I just want to make sure I have the correct number, and it is 319. So this was all last updated at 7:46 this morning.
So we've got 14 cases we know about.
Yes,
We've
that's
got
correct.
319 people in Florida who are being monitored.
Correct.
Who's vulnerable?
Well,
Who,
mm-hmm.
people can obviously, I guess a lot of people can catch this,
Correct.
but not everybody has sort of the serious symptoms and even, unfortunately, into death that we're kind of concerned about. So
Right.
who's vulnerable here?
Well, about 80% of the people who will contract the virus will have very mild symptoms. But the people that we are most concerned about is that 20% who are going to have adverse effects such as hospitalization and things like that. And what we're seeing in Florida and what we're seeing in the United States is those persons are 60 years old and up, and or people that have underlying health conditions such as diabetes, high blood pressure, heart disease, those types of things. So we're very concerned about those people, and what we need for everybody to do to protect themselves and to protect others they may come in contact with that have underlying health conditions or who are seniors is to, you saw the video, washing your hands. And I know, it might seem kind of strange to talk about people washing their hands, but when you start thinking about it and talking about it more often, it kind of becomes more of a, you're doing it more often and you're becoming more conscious of that. Not touching your face, your nose, your eyes, your ears, and things like that where those respiratory viruses can enter. So you want to try to avoid touching your face. And I know I think about it a lot more than what I was before this. And these are all good practices to do during any flu season or to prevent any kind of illness, really. So it's good that we're talking about it because not only can it help prevent COVID-19, but it can prevent other illnesses as well. So another thing you want to do is stay home when you are sick. This is critical. I know a lot of people feel like they have to go to work or they have to go to school or they have to. You need to stay home when you're sick to protect others from getting whatever it is that you have, whether it's a flu or COVID-19 or something else that you're sick. You need to stay home when you're sick. And employers need to have policies and practices that allow people to be able to do that. And avoiding coming in contact with sick people is also another good way to protect yourself from COVID-19.
If I'm one of these folks that maybe I'm not at risk, I'm young and I'm relatively healthy, but I still, is there concern there about me being around an elderly family member or some other family member or a friend or whatever? What are sort of the latest recommendations to sort of protect vulnerable populations? Just should we avoid them all? If we can avoid each other, or what do we need to do?
Well, I mean, if you are sick, you should definitely not go, to grandma's house. My grandmother, I know when my kids are sick or if somebody's been sick recently in our household.
Hard to keep grandma away from sick kids.
Well, but that's what we need to really practice. And if we do go see grandma, kind of staying 6 feet away. But if they're sick, everybody should be staying home, no matter if it's a relative, a visit to a relative. Another thing that you can do is to help that person in case we do start seeing cases in Bay County. You can help and make sure those people in those at-risk populations have the medications that they're going to need because they're going to need to stay home. If we start seeing a heavy caseload, that's what is going to be the best thing for them. And making sure that they have the groceries and other supplies and things that they need, or they have a way to get those things. So those are plans that need to be made now, not to scare anyone, but to prepare people in case we do have cases in Bay County, which we have no cases in Bay County.
How, when you say I need to be prepared at my house for maybe an extended stay at home, how long are we talking about? Do I need to be prepared for a long weekend? Is it this 14-day thing? Is it longer than that? What's the time frame?
Well, the pandemic recommendations from the CDC indicate that should be about 2 weeks, which is also the recommendation that we now have for hurricane preparedness. So if you guys have your hurricane kits still ready to go, you can just add a few more things, to that kit. You're still going to have access to your water system and electricity and things. So that's one of the good things. But if there are medications you need, your groceries, don't forget about your pets and what your pets are going to need during that time frame. But this is more crucial for those more at-risk populations than it is for the general population. And it's just because what we've been seeing with these cases, and we want to make sure that people have the best ways to protect themselves and are making those preparations just in case.
And again, and you said something earlier that I thought was really interesting. You said that 80% of the folks who may come in contact with this may not even know they had it or
right.
have it.
They could have mild symptoms or basically be almost asymptomatic. So it's just so important. Most of the time it's going to be a mild symptom if they do have it, but it's so important that we all are still taking those things. Like I said, washing your hands, avoid touching your face, avoid coming in close contact with, if you are sick, especially with those more vulnerable populations.
All right. If you're just joining us, we're doing a no fear, just facts information gathering session with the health department. We're talking about coronavirus. We asked some questions of you on Facebook, so we want to ask those questions. Cam Colson on Facebook wanted to know about, can I get it through the mail?
Okay.
If I order, we got our tax refund. We ordered
Right.
a lot of stuff at my house from Amazon. Amazon's very happy with me right now. But did I expose ourselves to coronavirus?
No, COVID-19 cannot be transmitted through the mail and through parcel services. With the transporting of those items, even though they're not sure yet on how long it can last on a surface, with the transporting the items, it would not have any of the virus left on it remaining by the time it gets to your house, if it were to ever have it. The recommendation, if you think for some reason that a package you've received may have some type of contamination, you can always use a disinfectant on the package before you open it, some Clorox wipes or Lysol wipes or any of those type of wipes that are going to tell you, that they kill germs. You can use that before you open it, and then after you open it, washing your hands for a good 20 seconds with soap and water, or using a alcohol-based sanitizer that has at least 60% alcohol. But there's no risk for you receiving packages in the mail, even if you get that package from China.
Yeah, obviously people get the made in China thing, and maybe they freak out or get a little concerned. And you're saying that no, there's no reason to be concerned.
Right.
You could, if you wanted to, sort of wipe the package down or whatever, wipe the item down, but the item, coronavirus, is not going to last through the shipping process.
No.
Okay, that's great information. Katie Rose wants to know, people who work with the public, they work in food service, they're out amongst the public all the time. What's the latest recommendation for those folks?
So I think I read one of those questions, and they were asking what they could do besides wash their hands and use hand sanitizer. So one of the things is, of course, stay home when you're sick. The employers of those persons need to make sure that they have policies that allow the employees to stay at home when they are sick. If there is a sick employee, they should be, this is all based on the CDC's guidance for employers, that sick employee, if they're sick when they first come in, they should be isolated from the other employees and then asked to go home. If they get sick later in the day, the same process should happen. They should isolate from the other employees and be asked to go home for the day. Other things that you can do as much as possible, use social distancing. You can stay 6 feet away from people, because we know that respiratory illnesses can come through the droplets. So those can spread up to 6 feet away. So do your best you can to stay 6 feet away from people. And also using regular cleaners to clean and disinfect commonly touched surfaces like doorknobs, workspaces, keyboards, cell phones, those types of things. If you can clean and disinfect those, and the employer should be doing some environmental cleaning, just your traditional environmental cleaning that should already be taking place, especially with us still being in flu season as well.
Social distancing, that's a new phrase that I think has sort of started. At least it's
Mm-hmm.
new to my ears.
Okay.
Talk a little bit more about what that is and why that's sort of been one of the new recommendations. I know you kind of explained it, but just explain just social distance, please.
Sure. So for social distancing, what that means is trying to stay 6 feet away from people. I don't know if we're 6 feet away from each other or
No,
not.
probably not. We're a little close, right?
But if and
Also, I just touched my face, so I've done all the wrong things in this thing, but that's okay.
Well,
Just tell us about it.
and those recommendations, are going to be more important if we do start seeing cases in Bay County. But it's something you do want to start to think about is how can you, when you're out, you can go out to the beach and probably be 6 feet away from people, right? So you can hang out at the beach and still be 6 feet away. So you just want to practice that. I know a lot of people are kind of doing the elbow. When I've been to some meetings, instead of shaking hands or, in the South, we like to hug a lot.
Mm-hmm.
So,
Yeah.
maybe not hug, kind of wave and figure out some other ways to say hello and greet people. So that's really what it's meaning, because those droplets can spread within that 6 feet radius. You're just distancing yourself from being able to end up with somebody else's respiratory droplets on yourself, and then you're not washing your hands and touching your face, and then you end up with, whether it's COVID-19 or the flu, those are all concerns and all good practices to have if we were to have, even, like I said, if we were to have a flu season that was very active, then that would be a good practice for somebody to have as well. But
All right. Masks are another big
yes.
question involved in this, and there's been some everybody, I think, to start with, wanted to go buy a mask
Right.
and wear it all the time. That's not as I understand it, that's not the guidance from the CDC or the Department of Health, right?
The CDC and the Department of Health do not recommend that persons who are well wear masks. Persons who are sick should wear masks in order to avoid infecting other people. Also, our first responders, our medical folks have special N95 masks that they are fitted for because they're going to be coming in contact with a lot of different people that they're going to be needing to see and treat for all different sorts of illnesses. So they have those. And again, that's a special fitting test and things that they need. But those are the only people that need to be wearing masks. It's those people who are sick with a respiratory type illness or people who are in the medical field, first responders for those medical calls.
All right. One of the things that, and we've seen this again locally, that we recently, the school system canceled a trip to, I think the kids were going to Ireland. What's the recommendation on international travel for just right now?
Sure.
What's the recommendation coming from the CDC? International travel. We'll also talk about cruises.
Okay.
And maybe some domestic travel. But
Sure,
let's start with
sure.
international.
So the overall recommendation is that for any international travel, you should practice self-monitoring. So what that means is that you should monitor your symptoms. But there's a couple of extra things to add with that. So if you go to a country that has a level 3 travel alert from the CDC, and it's not important to focus on what those countries are right now, because that guidance could change. So you want to go to the CDC's website, and if you go to cdc.gov, you just click right there on COVID-19. It's going to have all that information for you. You can click on travelers, and it will tell you what countries fall under that. So if you go to a country with a level 3 travel advisory, you are to mandatorily self-isolate for 14 days.
I'm sorry. What are some of
Sure.
the countries that are level 3 right now?
Well, right now it's
Italy, China.
Italy, South Korea, China, and I'm missing one right now.
You don't have to do all of them, but the ones obviously level
Right.
3 probably means the ones that are having a pretty serious outbreak.
Yes, they're
right?
having serious community countrywide outbreaks. Japan is on that level 2 list. They are experiencing some. Cruises, as you talked about, are also on that level 2. But the CDC is recommending that people not travel by cruise and especially those with underlying health conditions. But it is on the level 2 travel alert, meaning that when you return from a cruise, that you should self-monitor and limit your contact with others. Well, in some people's jobs and positions, they might not be able to necessarily limit contact, so their employers may decide that they need to self-isolate because they can't have them, limit contact, because they may be, their type of position may have them in contact with the public, it may have in contact with students, or so on and so forth. So those are the guidances that we have right now, and those are important to keep updated on, because those could change also as this evolves over time.
How about domestic travel?
Sure.
You got any restrictions on domestic travel right now?
There are no restrictions.
I want to go to Disney World, Heather.
Disney World. There are no travel advisories for Disney World.
Okay. I mean, the other theme parks, the other places inside the continental United States. I'm going to spring break. Bay County spring break is next week. I'm going to pack these kids in a car and go somewhere. Inside the United States, there's no restrictions on travel.
There are no restrictions, but you should still practice all the same safety measures that we're asking you to do at home. I know when we're on vacation, we tend to kind of relax, but you still need to be practicing the hand washing, hand sanitizer when you can't wash your hands, cleaning and disinfecting of surfaces when you can. Also, if someone's sick, stay at home. Even if you're on vacation, they need to stay at home and not go out that day. So you need to practice all the same things you would at home, no matter where you're at.
Okay. One of the things, living in Panama City, we live in paradise. We get to go to the beach. We have Pier Park. We have all these wonderful places that we can go to. But we're a tourist community, so the international community comes to us. Are there some concerns there about visitors and what we should do if we're just as a local going out, this March and April, going out somewhere?
Again, it should just be those same precautions of washing your hands. When you're sick, staying at home. Excuse me. If you can't access soap and water and wash for 20 seconds, then you should be using an alcohol-based sanitizer with 60% alcohol. There's nothing extra or anything you need to do with that. I mean, if you were to, for some reason, think that you had come in contact with somebody who has COVID-19 and you're experiencing respiratory distress, you have a fever, coughing, those types of things, then that's something that you should consult with your doctor on. And also call the health department. Your doctor and the health department will be able to give you instructions and next steps with that. They will let you know what you need to do. You do not need to go to your doctor's office or to the health department. We want to do everything we can if you have been exposed to COVID-19 to prevent potential exposure to other persons. So they'll give you instructions and kind of go through a screening process and see if you are somebody who should be tested for COVID-19. And the doctor's offices can do testing too. Both LabCorp and Quest are able to do that testing. And then, of course, whenever they're able to take the doctor's samples to do the testing. And then, of course, at the health departments, we're able to do that testing as well and send that to our state lab.
There was a concern. That was one of the questions we got, that there aren't any tests in Bay County, or that we can't get tested, or whatever. They're saying that's not the case.
No, if they need to be tested, they feel like they have been exposed to COVID-19 and they are experiencing symptoms, they need to call their healthcare provider and also the Bay County Health Department at 850-872-4455. Again, that's 850-872-4455.
Before we got started, our general manager is a guy named Terry Cole. He came up to me very excited, because Terry's always very excited, if you know Terry. And he wanted to know if heat or cold would kill it. Will heat or cold kill COVID-19?
A lot of people are asking that question right now, and we don't really know the answer to that yet. Of course, we know that the flu season is typically with colder temperatures, and as things get warmer, the flu seasons typically die down. But we don't know the answer to that question yet, but it's definitely a good question and something I know that the CDC is looking into.
Let's go over the symptoms one more time.
Sure.
Somebody thinks they're sick. You told people what they need to do. They need to call the doctor, and then they need to call you guys.
Right.
But what are the, what's the difference between I've heard a lot about this on the news and now I feel bad and I'm actually sick and I need to call somebody?
Sure. You have respiratory illness, fever, shortness of breath, cough. It's going to be very similar to the flu. And, we do still have the flu that is going around the state in, some level of activity here in Bay County. So it could be the flu, but if you feel like you've been exposed to somebody with COVID-19, if you've had international travel, if you've been around someone that, has had international travel, some of those kind of things might, point you more towards wanting to have this checked out. But those are the symptoms, and again, they can be very close to the flu, so I know it can be confusing for people when they're trying to figure out what's going on, but they can kind of look at some of those different details and things as far as their travel, other people they've been around travel, and make those decisions with their healthcare provider, consulting with them, and also contacting the Florida Department of Health in Bay County.
All right, let's wrap this up. What's sort of the main thing you want people to know, the main thing you want people to take away from this? Just tell me what it is.
Well, the main thing is the information is changing with this, so we encourage people to go to our website, floridahealth.gov, and you'll see COVID-19 right there in the middle, and they can click on it. And a lot of the things that we talked about here today are readily available on that website. And then if the information changes, they'll be able to go there and see it. And of course, if we have any cases or any important information to get out to people, we are going to do that. We are going to be that source for you and make sure that you're informed and you know what to do for you and your family. And again, although it may sound kind of, like, okay, yes, I'm already doing that, washing your hands often, being careful about touching your face, those kind of things are going to go a long way in helping keep you from getting sick. And then staying home when you are sick is going to help prevent you from getting other people sick, including those vulnerable populations we talked about, the seniors that are 60 plus and those with underlying health conditions. It is crucial that we do our part to protect those people.
Heather, thank you so much for being here. Thank you guys for watching. We're going to have the whole session. If you're just tuning in and you missed this, we'll have the whole session on our website, mypanhandle.com, on the My Panhandle mobile app. And again, thank you for that good information. We don't want to scare people. We just want to give people the facts on coronavirus. So thank you very much.
Thank you.
And we will see you guys next time.